Gentlemen, let's talk about something important. Have you ever noticed how men often stare at a woman's breast, but when it comes to actually touching it, things can get rushed or awkward? That's a big missed opportunity. Here's the truth: a woman's breasts aren't just for show, they're incredibly sensitive and can carry deep emotional significance. When touched with care, patience, and skill, they can bring immense pleasure, sometimes even lead to climax. In this video, I'm going to share 9 proven, respectful ways to touch her breasts that not only drive her wild, but also strengthen intimacy and trust. Before we dive in, I'm Dr. Ada James, a urologist and expert in men's health with over 10 years of experience helping men enhance intimacy, vitality, and confidence. If you value your health and relationships, hit that subscribe button, like this video, and drop a comment to let me know where you're watching from today. I love seeing our growing community worldwide. Now, let's get started. Let's start by clearing up a big misconception. A lot of men think breasts are just for looks, that they don't hold much sensation for women. That's completely wrong. The breast, especially the nipple and areola, is packed with nerve endings. For many women, just touching these areas can spark intense arousal. For others, it's the emotional connection, the feeling of being fully seen and cared for, that makes the experience so powerful. When you approach this with patience, respect, and a little know-how, it becomes more than just touching her chest. It transforms into a deeply intimate experience that can bring you closer than you imagined. And this isn't just fluff from a magazine. Over the last 5 years, I've worked with hundreds of men and couples, and I've seen the huge difference between those who rush or fumble and those who take their time, understand her needs, and use their hands, mouth, and presence to really connect. Women can tell the difference instantly. So let's get into the 9 steps that can turn something awkward into a moment of confidence and true connection. Tip number 1, start with consent and curiosity. There's nothing more seductive than trust and safety. Instead of guessing, just ask, how do you like your breasts touched? Softer, firmer, with my hands, my mouth, any areas I should avoid? That simple question will immediately put her at ease, build trust, and give you the direction you need. You can even agree on a signal system while you explore: green for more, yellow to slow down, and red to stop. This takes the pressure off both of you and creates a fun, collaborative vibe. Biologically, this triggers her parasympathetic nervous system, basically the relaxation mode. Emotionally, it shows you care, and practically, it ensures she's relaxed and ready before you even begin. Tip number 2, slow down and start broad. Here's where most men go wrong. They rush straight to the nipples, too fast, too soon. Instead, begin with a slower, more deliberate approach. Use warm hands to make broad strokes along her upper chest, down the sides of her ribs, and the soft curve where the breast meets the torso. Add some gentle kisses along her collarbone, neck, and jawline. Why? Because the nervous system doesn't jump straight into pleasure in a split second. You need to give her body time to shift from guarded to open. This is when touch becomes electric, not just ticklish. Biologically, you're gradually activating nerve pathways. Emotionally, she feels cared for, not rushed. And practically, this is the difference between just okay and something amazing. Pro tip: a little unscented, body-safe lubricant can make your touch glide effortlessly. Tip number 3, hold with purpose, not force. A lot of guys make the mistake of pinching or squeezing. That's not the way to go. Instead, think cradling. Use your whole hand to support her breast, gently alternating between light pressure and stillness. This kind of touch signals safety and desire. Her body will relax, oxytocin levels will rise, and her arousal will build. Watch for her cues, her breath changing, soft sounds, or her leaning in closer. That's your green light to keep going. Biologically, you're engaging the tissue without overstimulating nerve endings. Emotionally, she feels held, not grabbed. Practically, this is how you build up anticipation and excitement. Tip number 4, don't ignore the areola. The areola, the darker ring around the nipple, is just as sensitive, sometimes even more so than the nipple itself. Try gently tracing slow circles or spirals around it, teasing just toward the nipple and then pulling back. Make sure to support the breast tissue underneath so it never feels like it's being tugged. This balance of teasing and support can send electricity through her whole chest. Biologically, the areola has hundreds of nerve endings, making it highly sensitive. Emotionally, teasing like this builds anticipation. Practically, this is the perfect setup for what's coming next. Tip number 5. Treat the nipple like a dimmer, not a switch. The nipple is sensitive and powerful, but it's best approached gently. Start with soft, feather-light strokes. If she wants more, gently roll it between your thumb and finger, or try a press and release. Avoid quick tugs or sudden moves. They can be painful rather than pleasurable. And don't forget, a little lube helps reduce friction on delicate skin. Build up slowly and always check in with her. Biologically, nipples are packed with nerve endings, and overstimulation can lead to discomfort. Emotionally, being gentle shows you care. Practically, this prevents you from hitting an ouch moment. Tip number 6. Use your mouth with intention. If she enjoys oral stimulation, start with warm breath, then gently trace your mouth around the areola before moving to the nipple. Gentle suction can feel incredible. Avoid hard suction or using teeth unless she specifically asks for it. If you're curious about playful grazing, practice on your own forearm first to get a feel for how light you should go. Biologically, warmth and moisture heighten sensitivity, making everything feel more intense. Emotionally, this creates a sense of closeness and attentiveness. Practically, mixing things up keeps the experience fresh. Tip number 7, use words and breath to enhance touch. Touch is powerful, but adding words and breath takes it to the next level. Soft, sincere compliments, a calm voice, and simple questions like, "Does this feel good? Softer here?" make a difference. Match her breathing. When you exhale slowly, it relaxes you both and signals safety, allowing her arousal to grow. Biologically, synchronized breathing activates mirror neurons, strengthening the connection. Emotionally, she feels seen and heard. Practically, this creates a deeper level of intimacy. Tip number 8, pair breast play with what brings her pleasure. Studies show most women climax most reliably with steady external stimulation in sensitive areas. Pairing breast play with this can intensify the experience. Keep one hand or mouth on her breast while your other hand or a device focuses on external stimulation. The key is to only change one thing at a time so she can fully focus on the sensation. Biologically, you're creating multiple pleasure pathways. Emotionally, she feels fully immersed. Practically, this creates a total body experience. Tip number 9, temperature and tools only with enthusiastic consent. For those who are adventurous, a cool fingertip, a warm hand, or breath on the nipple can heighten sensitivity through contrast. If using devices, choose adjustable, high-quality options and start with the lowest setting. Always stop if there's any discomfort, numbness, or blanching, and avoid these methods if she's pregnant, sensitive, injured, or has medical concerns. Biologically, temperature changes stimulate thermoreceptors. Emotionally, novelty can be exciting, but only if it's consensual. Practically, safety should always come first over experimentation. Here's your action plan. Start with communication, consent, and curiosity. Begin wide, then move in slowly. Let arousal build naturally, with intention, not rush. Support, cradle, and care. Pay attention to her cues, her breath, sounds, and body language. Layer in sensations with your hands, mouth, and words. Pair touch with what really excites her. Afterward, don't just roll away. Stay close, breathe together, and let everything settle. Many women say the decompression afterward is the most satisfying part. Remember, you don't have to be perfect. This isn't about tricks or memorizing steps. It's about being present, listening, and letting her body guide you. Some days she'll love it, some days she won't be in the mood. That's okay. Respect that, and next time, she'll trust you even more. Biologically, her responses shift based on hormones, stress, and energy. Emotionally, flexibility builds trust. Practically, this is about real intimacy, not performance. This is how you turn breast touch from a rushed afterthought into a deeply intimate experience, one that makes her feel safe, desired, and fully alive in your touch. And remember, age isn't a barrier to intimacy. In fact, maturity gives you the patience and confidence to do this better than younger men. Start slow, be intentional, stay curious, and you'll deepen your bond while giving her more pleasure. If this helped, like the video, subscribe, and share it with a friend who could use a little encouragement. Let me know in the comments which tip you'll try first. I'm Dr. Ada James, reminding you that your best years of intimacy and connection are still ahead. Stay strong, stay kind, and take care of your health, body, and relationships. You deserve nothing less.